Alright, so hi, my name is Jimmy Guzman. I'm going to be doing an eye inspection video on my partner Usada here. Alright, so we're going to go through several different situations. We're going to do proper palpations of the face. We're going to go over a general eye inspection involving the eyelid and the cornea. We're going to do eye tracking and then a pupillary response test. We're going to also do a visual eye exam using an eye chart. And then last but not least, we're going to use an ophthalmoscope to test the eye in several different areas. Alright, so let's get started. So the first thing we're going to do is proper palpations. I'm going to palpate the zygomatic bone. Alright, so we're going to come along the cheekbones right here. And what we're feeling for, fractures, discoloration, ecchymosis, pain with palpation, point tenderness, and especially numbness of the face, so you want to be checking for nerves and things like that. We also want to check the maxilla bone along the top ridge of the mouth here, so you're just going to press in, feeling for all those signs and symptoms there. Alright, feels good. Then we're going to feel the frontal bone here on the forehead, and you just walk your thumbs across, applying slight pressure to each one. Alright? Then after that, we're going to go over the nasal bone. We're going to start at the top here and press all the way down, pressing inwards as well. And everything feels all right. And then last one is we're doing an eye exam, so of course we're going to palpate the orbital bone around the eyes as well. So make sure your patient is comfortable with you in the first place so that they trust the fact that you're pressing into their eyes. All right, so here we go. I'm just going to press down and around. It feels good. No pain. Patient looks comfortable. And you can feel everything as I do this?
Yes.
Okay, good. Alright, so there's your proper palpations of the face. Next we're going to do a general inspection. So that includes the eyelid and the cornea. So what we're going to do is we're going to look at our eyelid. We want to look for swelling, ecchymosis, discoloration, lacerations, and any signs of a sty or something like that. Alright, so I'm just going to get close and personal here, and we're going to look at the eye and make sure none of that. There's no swelling. I don't see any discoloration, no pinkness in the corners of the eyes, anything to tell me that she has pink eye or anything like that. Okay, and then we also want to look at the cornea, just a general view. We want to look, make sure it is clear, that's not cloudy or milky or anything like that. We want to make sure there's no discoloration, different colors of the eyes, such as being yellow, signs of jaundice, things like that. And most importantly, you want to check if there's any lacerations, any cuts, or debris in the eye of any sort. So just come in here, you just take a real good look inside and make sure everything's clean and clear. Can you see all right out of them?
Yes.
Okay. Alright. So after that, we're going to do the pupillary response. And to do that, we need a pen light, which I got here. So any training room or any doctor's room should have one. You just click it on and off. What we want to do is test the pupil. So you want a dim lighted room. What you do is you just dim the lights or turn them off if you can. And you're going to bring the light in from the side of the face to the front of the eye, surprising the pupil. And what you want to have happen is you want it to constrict, meaning that the muscles, the ligaments in the eye are all properly functioning. So right here we're going to come from the side, and I just want you to look straight ahead. Alright. Okay, you hold it there for a second, make sure it constricts. You give it a few seconds, come back again. Alright, so that eye is functioning properly. You come from this side. Alright. Alright. So both of her eyes constricted very well. There's no problems. If they weren't constricting, if they were staying dilated, you would have problems in a musculature, ligamentous standpoint, possibly concussion signs, symptoms such as those. Alright, so the next thing we're going to do is eye tracking. So you can hold on to your pen light here, and all we're going to do is we're going to have them follow the object that we have in our hand in several directions and make sure that they can track, because the muscles of the eye, there's 4 that pull it up, down, side to side. Alright, so we're just going to have them follow the pen light here. Alright, so I just want you to, with both eyes, to follow the pen directly in front of you, okay? So you want to be sure to move at a semi-quick pace, but you don't want to be flying all over the place, and you don't want to be at a standstill. Also, you want to go diagonally, all right, making sure we can use a combination of all four of the muscles in the eye. All right, you should perfectly follow the pin on every movement there. All right, so before we get into the actual vision exam with the ophthalmoscope, we're going to do one more, which is the vision exam using an eye chart. So what we would do if we're in the training room, doctor's office, some sort, we would use this eye chart here. All right, so what we would have them do is we would have the patient stand 20 feet away from the eye chart. It would be at eye level to them. And how the eye chart works is we would ask them a series of questions, including questions about eyewear, whether they wear glasses or contacts. If they're playing a sport, we want them to test in what they wear during the sport. And so obviously we would test Isada here in her glasses. So how we're going to run the test is she's going to stand 20 feet away, and what she's going to do is we're going to cover one eye at a time and test one eye at a time to test her vision in each eye. So I would have her cup, not flatten her palm out, but cup around one eye, and she would read down the chart from top to bottom, left to right. All right, and you go all the way until you misread at least one letter. And then at that point, you will read the number to the left of that line. So if she misread the D in this line, we would go to the previous line and we would read this as her vision for that eye, for her left eye. So in this case, 20/40 would be the score that she got, which means that she sees in 20 feet where most people see in 40 feet. So her vision in her left eye wouldn't be as great. Now, if she read much lower, if she read a 20/15, that would mean that she sees in 20 feet what most people have to see 15 feet away. So that would be better vision for her. We consider perfect vision at least 20/20. All right, and then to finish the exam, we want to use an ophthalmoscope. Here we have one in the doctor's office. Most doctor's offices, training rooms will have. So how these work, you can turn them on and you can see they shine a light through them. You can dilate or constrict this light, making it dim or bright as you need it. So there's a 5-step process that we want to go through. The first two include setting your number for your eye. And how that works is on the back of all ophthalmoscopes, they have a number in the center. You start at 0, and they have dials on the side. So the two things that we want to set are your short focal length and your infinite focal length. And these are the numbers that you will use to test on any vision exam from there on out. So I'm going to find my short focal length lens. So what I want to do is I want to hold my fist in front of me, about 3 inches in front of my eye. I want to dilate the light so that it is at its brightest. All right, and then I'm going to look into it, and I'm going to dial the right side downwards, and that's going to bring up green numbers between 0 and 20. And I'm going to look through until I can find a perfect vision of my hand. All right? So I look through. All right. So I am a green 3. That is my short focal length number. All right? So I will remember that for the test. Next, we're going to find my infinite focal length. And to do that, we're going to look at an object far away, and we're going to dim the light down to a very dim light. So we'll put it back to 0. And now this time, I'm going to look through the ophthalmoscope at a distance, and I'm going to dial the left side downwards, and that'll bring up red numbers. And these will be between 0 and 20. And I want to look through at the infinite object until that is perfectly clear to me. All right? So I'm going to go and I'm going to look at the fire alarm here. All right. So I am a red 1. All right? So that is my infinite number. So after that, what we're going to do is we're going to set our patient. So those are the first two steps. The third step is putting your patient in a position that you can examine them in without any trouble. So what we want them to do, we want them to sit upright, we want them to be comfortable, and then we want to give them an object to look at straight ahead so that their eyes don't wander and they have something to look at as you visually examine their eye. So I'm just going to have you stare straight ahead at that object on the wall there. Alright. After that, we're going to go over the fourth step, which is your hand placement as the examiner. Okay, so if you don't use your hand during an eye exam, a lot of times you will bump heads and you can cause problems, and it's kind of hard to get close to the patient without understanding where you are. So what we do is if we're examining the left eye, we're going to hold the ophthalmoscope in the left hand, we're going to use our right hand, we're going to place it on top of their forehead, and then we're going to place our thumb over their eyebrow of the eye we're examining to keep it open. And now we can use this as a barrier when we come in close, and we can use our proprioception to tell us how close we are to them. So, now that you're set, you've done your settings on the ophthalmoscope, and you know how to examine the patient, now we can visually examine them through this. So there's three things that we want to examine. We want to examine the cornea using the short focal length lens, which would be my number 3. And then we want to examine the optic disc and the retina using our infinite focal length, and I would use my red one for that. And then our last one, we're going to examine the iris, and to do that, you're going to dial the right side down to a green 15 to 20 on average. This will give you your best view of the patient's iris in the back of the eye. So first one we'll do is the cornea using my short focal length lens. So I'll turn it on, and I want to make sure the light is brightest. And then I'm going to set it to my number, which is a green 3. Alright, get in position for the left eye. And then I'm going to come in from the top, and I'm going to examine the cornea in the lens. Alright, so that turns out pretty clear. No lacerations, of course, as we saw earlier, and there's nothing wrong in the side of the cornea. The next one we want to do is the infinite focal length lens. So I'm going to dial it to my red 1, and I'm going to dim the light again. And then we're going to use this to visually examine the optic disc and the retina in the back of the eye. So same protocol. We want to place our hand over the top, thumb on the eyebrow, come in from the top, directly to the back of the eye. So from there, we have a clear visual field of the optic disc and the retina, and we could clearly examine the patient from there. The last thing we want to do is examine the iris, and so to do that, we would dial it to a green 20, which is pretty common. That's your best visual field of the iris, and we're going to examine it the exact same way. And you want your light up, like that. You're going to place it on top of the head, on top of the eyebrow, and come in to the iris. Alright, she checks out, everything is alright, and that is your visual exam. Thank you.